They say Papua New Guinea is the hardest place to deliver healthcare in the world because of our isolation. Over 80% of our people live in rural areas. I've felt this isolation as I have fought for women and their babies. Sometimes we improvise with what we have available to us. Sometimes we can arrange emergency transport to a hospital. Sometimes we simply pray. YWAM started coming to our province 4 years ago, working alongside our team to help deliver health services and training to remote communities. Their coming reminds me we are not alone. Together we can see changed.
Most amazing disease we have seen was filariasis or elephantiasis. Most of us have seen a picture while we were in medical school and never again. A rare condition limits the people's ability to walk. It becomes hard. They have huge feet, which look like elephant feet, and that's where the name comes from. We called the ship, and they found in the pharmacy of the ship a load of the medication and sent it over. And we gave it to the local nurse, explaining exactly how to use it. We gave a drug named albendazole to every child in the village, which will prevent the spread of filariasis.
I met a young girl this morning with her mother, and she had multiple sores on her legs. She was seen by the doctor, and then the doctor asked me to look after her wounds, and they're related to mosquito bites. And she's been scratching them madly because obviously they're itchy. It's typical areas of the body that are uncovered when we're asleep or during the day, and she has gone crazy scratching them. So I cleansed them with betadine, I put some Gelinet on them, some non-stick dressing, and then I actually bandaged them up. If we hadn't have looked after those, they would have become severely infected and she could have developed cellulitis, and if cellulitis is not treated, that can go on to actually, in a child that age, cause very, very high temperatures, even death. So the role of what we do here is amazingly important.
Okay, Boss Mary told us, he said, "Sister, there's a need. I want to transfer you to Bamio. Do you want to go?" And I said, "Yes." I said, "I asked the Lord, where there is a need, send me." And that is the reason why I am here.
This hospital was built by Bamio community. Mothers and fathers, they came together and worked with their own bush materials, what they have used in their homes.
When I first came, I stopped at the waterfront, and the skipper in language said, "This is a nurse that is going to work in here." And they washed my legs. I said, "No, I'm not a very special, don't wash my legs." "No, we will wash them." And I had tears in my eyes, I was crying.
Community take care of her by giving food, what they have in their home, whatever we have in the community, people used to give.
Since I came in year 2014, I was using torchlight to help the mothers and the sick people. And in year 2016, the YWAM boat came, and when they put on this solar light for me, it's easy for me to help the patients and look after them with this light.
This is a small picture into some of the amazing Papua New Guinean healthcare workers working tirelessly for a better future. Today, you can be a part of that picture by strengthening these partnerships. $350 can provide medical treatment for 10 people. $750 can provide training and support for a healthcare worker. $1,800 can provide a health facility with solar power, or you can provide all three for $2,900. Your gift has the power to change lives. Give your tax-deductible donation today.